I'm Dr. Walid Munir. I'm Assistant Professor of Otolaryngology Department in Mansoura University. Today, we are talking about congenital and traumatic lesions of the middle ear. First, the congenital lesions. They are either middle ear cavity aplasia or ossicular aplasia. The most persistent sign of both lesions is the conductive hearing loss. Also, dehiscence of any wall of the walls bordering the middle ear resulting of either accidentally injury to each of the important structures surrounding the middle ear or spread of the infection to each of them. As regard to traumatic lesions of the middle ear, they are temporal bone fracture, traumatic perforation of the tympanic membrane, otitic part trauma, and ossicular disruption. First, as regard to temporal bone fracture, these figures are showing us the 5 parts of the temporal bone. There are 2 types of temporal bone fractures according to the direction of the trauma. The direct trauma on the side of the skull causes a longitudinal fracture, whereas the indirect anteroposterior trauma causes a transverse fracture. The longitudinal fracture affects the external ear, tympanic membrane, and middle ear, whereas the transverse fracture affects the inner ear. So, as regard to longitudinal fracture, the hearing loss is a conductive type. The tympanic membrane ruptures leading to otorrhea commonly, and vice versa as regard to the transverse fracture. The facial nerve is more common to be affected in cases with longitudinal fracture than those with transverse fracture due to the more incidence of the former ones. The post-traumatic vestibular symptoms is more common with the longitudinal fractures. These 2 photos are showing us the transverse and longitudinal fractures appearance in CT. The investigation of temporal bone fractures are CT and audiological evaluation for all cases, but facial nerve tests and vestibular tests are requested only if needed. The treatment of the fracture is according to the symptoms, either conservative or surgical. The second traumatic lesion is tympanic membrane rupture as a result of either direct or indirect trauma to the tympanic membrane. The traumatic perforation of the tympanic membrane is mostly anteroinferior. Unless it's a self-inflicted, it will be posteriorly. This slide is showing us the differential diagnosis between the traumatic perforation of the tympanic membrane and the central perforation resulted from chronic subotitis media of tubotympanic type. The complications of the tympanic membrane rupture are otitis media, permanent perforation, and disruptured ossicles. Then the treatment is mostly conservative by keeping the ear dry for 3 months. If spontaneous healing doesn't happen in 3 months, meninoplasty is indicated. The third traumatic lesion is the otitic part trauma that's resulted from negative pressure on the middle ear mucosa and tympanic membrane due to disventilation of the middle ear resulted from occlusion of the Eustachian tube during changing the atmospheric pressure. These symptoms of the otitic part trauma are in 3 stages of otitic part trauma, which are mild negative pressure leading to retracted tympanic membrane, moderate negative pressure leading to middle ear effusion, and severe negative pressure leading to tympanic membrane rupture. These are the photos of the retracted tympanic membrane, and here are the photos of the middle ear effusion, and finally these figures are for tympanic membrane rupture. Lines of treatment of the otitic part trauma are prophylaxis by Valsalva maneuver as shown in the photo, and medical treatment, and surgical if residual middle ear effusion or perforation residue after conservative or medical treatment. The fourth traumatic lesion is the ossicular disruption that's resulted from trauma to the middle ear. It causes conductive hearing loss and tinnitus due to loss of amplification mechanisms of the sound in the middle ear, and the treatment is the ossiculoplasty. Thank you.